$50 Copland's flagship joint. Discreet on prices, an autofocus with mad 61 points with dreams of being the nicest. The drive mode like a fully auto Tech 9 with sound. Not speaking violence, just canning the camera with a corporate type style that shines like diamonds. Peace, $50, and what it is, following 2 G's. And yo, there go the beast, Peace, $50. Welcome, I am $50. This is Paxlovid911.com. Paxlovid911.com is to prepare you for the reality of catching COVID-19, detecting it early, and once you detect it, being able to treat it immediately. If you go to the doctor and with like you went to the party the night before and you detect that you have COVID-19, or you go to the doctor and detect that you have COVID-19 with a home test kit, or it's better to prepare yourself for going to the doctor to know that you have COVID-19. If you went to the party, you know you've been around a lot of people and you possibly contracted COVID-19, then you better prepared for the difference of going to the hospital. For the doctor, when the doctor sees you, the doctor is prepared to treat you if you tell them that you took the home test kit, you took the home test, and you was at the party, you was at the rally, you was at the festivities of spring break, and you believe you contracted COVID, and you want to take the test, or you took the test, and you go through the preliminaries. But when the Paxlovid pill is available, it's available for certain people. When you detect COVID-19 early and you take the pill, and 5 days later, COVID-19 is eliminated. You don't have no COVID-19 no more. So when you go through the preliminaries of taking a home test and then going to the doctor and getting a prescription for Paxlovid is a pill that you take if you find out you have COVID early. If you find out you have COVID early, but you don't have no symptoms or anything like that, you just find out you have it, and you take the pill, and 5 days later, it's eliminated before you even have symptoms. You may have symptoms after taking the pill, but the point of the matter is, you take the pill, and 5 days later, COVID-19 is eliminated, as opposed to not knowing you have it or being around a lot of people. It's spring break right now. Right now it's spring break. You go to spring break and you're around all those different people from all over the United States and the world, and then the influx of migrants, a factor at the beach, at the festivities of spring break, and you don't know who you're around or anything. So now it's like, it's even more so dangerous, but you rarely have the symptoms the same time that you catch COVID. You don't have the symptoms the same time you catch COVID. It trickles down like New Year's, Christmas, all those festivity times of the year that went by. Now you have the results of people dying and getting gravely ill based on contracting COVID or being exposed to that audience of people around those times of the year. Now, when you in danger of contracting COVID, you're not in danger of dying in the same place, the same way it was initially. Initially, it was you contracted, and a few days later you'd be dead. It wasn't no cure. It was just it was just spreading so rapidly that nobody knew what it was or anything. So now that you know what it is, finding out you have it or you contracted it around a lot of people or people from different parts of the world and things like that, now you have an option to treat it with Paxlovid. Now, Paxlovid911.com is to get you the pill at Amazon. Paxlovid, particularly Amazon, because Amazon is a neutral, universal platform that you can be treated without being before a doctor can prescribe you Paxlovid, but a doctor doesn't have to follow you around taking the pill orally. You take the pill 5 days at home and COVID-19 is gone. The doctor doesn't have to be there. You may have to follow up and get a check to see if you still have COVID, but you don't have to have the doctor with you to eliminate COVID. The Food and Drug Administration approved Paxlovid for emergency use. When it was approved, it was never applied to an actual application. Like Paxlovid911 is to apply having Paxlovid pill to having the ability to put it at Amazon. So if you just arrived here from another country, you can order Paxlovid through the mail and get it the same day. With Prime membership, you can get Paxlovid pill the same day. Without having Prime membership, it may take you a day or so. It may take you a day or a couple of days, depending on Amazon service. But based on Paxlovid911 informing you on what your options are, or possibly getting Paxlovid pill to Amazon, because when it was approved for emergency use, it didn't have any application particularly, because if you have a crowded emergency room and you have the Paxlovid pill, it's still crowded. You have to diagnose the patients. You have to find out what exactly is wrong with the patients. You don't know if they have COVID. It could be the flu. It could be anything. So just a mechanic fixing a car, hypothetically, compared to a doctor working on people, in comparison, the Paxlovid pill at the hospital doesn't help the influx of patients from COVID-19 infecting people at the beach, at the rally, full-blown patients, emergency room patients for wherever they usually be in the emergency room for, and all that going on in the hospital. So the outlet is people who have to die. That's the outlet, because the doctor can't keep up with it's not the same if it's a car. The car just breaks down and doesn't work. It's not the same. If the car breaks down in the case of it being a person, you die. It's no way to help you, because the next patient coming in the door from spring break and, want to see if they have COVID, found out they got COVID, having symptoms of COVID, and it's all on the doctor. It's all the doctor. Paxlovid911 is informing you now of what the doctor's up against. At the hospitals, you have no idea what the doctor's up against. The doctor has to determine who lives and who dies. It's completely an extreme situation going on in every hospital. The influx of migrants at the border, they broke in the border yesterday. Today is March 23rd, 2024. They broke in the border yesterday, March 22nd, 2024. So when they broke through the border, they possibly carrying, COVID-19. In large numbers and crowded situations, they don't have no vaccines or anything. They just at the border trying to get in the United States. So being a primary focal point of COVID-19 lurking, and them going to the beach and participating in the festivities of spring break, everybody in America is exposed to these people that are in circulation of contracting COVID. So my suggestion was, when Food and Drug Administration approved Paxlovid for emergency use, I immediately said, we need that pill at Amazon. Amazon is to be a perfect neutral place, not a hospital. You're not hanging around saying you think you got COVID. That's not the situation at Amazon. Amazon is like a grocery store. They have all different type of products, and you buy their products and leave. You don't have nothing to do with COVID at Amazon. But when you have COVID-19 and you have a home test kit, you can get a home test kit more than likely from Amazon. But having access to Amazon with Paxlovid pill improves the probability of COVID-19 being eliminated. Because if you can eliminate COVID-19 as soon as it's contracted, from the border, from the migrants at the border, from the rallies, from the spring break festivities, if you can eliminate COVID as soon as you contract it, that means that the hospitals can treat COVID to eliminate COVID at the hospital. So it's two fronts. You eliminate COVID as soon as it's contracted, and you eliminate COVID from full-blown patients that are treated in the hospital perpetually. Those patients are perpetually, treated because they're always there. They have lung disorders. They have all types of illnesses attributed to contracting COVID. So that's what Paxlovid911 is about. Paxlovid911.com is I'm the founder of Paxlovid911.com. I'm the Paxlovid911 founder. I created a way to expedite being treated for COVID-19 where it doesn't exist. Where Paxlovid pill isn't at Amazon right now, I still created a way for you to have access to Paxlovid pill after detecting COVID-19 early, where it doesn't exist. The process doesn't exist. And along with Paxlovid911.com, I created a process that has nothing to do with the Paxlovid pill per se. It gives you access to other vaccines: Moderna, Pfizer, Johnson & Johnson, Novavax. Pfizer is the maker of Paxlovid pill. But Moderna, Pfizer, Johnson & Johnson, Novavax, those are different vaccine suppliers, that manufacturers that, in my process, I created a way to have access to those suppliers as opposed to only being limited to Paxlovid. Paxlovid is only a preventive type medication where you detect COVID-19 early, and to prevent from it being full blown, you take the pill 5 days straight and COVID-19 is eliminated. That's more preventive. It's a form of treatment, but it's preventive more than treatment, where if you have full-blown COVID-19, you had it for a few weeks and it's making you gravely ill and you could die and you have to be treated repeatedly with certain medications. That's not Paxlovid. Paxlovid is, if you detect you have it early, take the pill 5 days straight and eliminate COVID-19 and its symptoms and its illnesses and whatever's connected to COVID. Paxlovid911 is of my design, my creation. When I apply Moderna, Pfizer, Johnson & Johnson, Novavax, those medications aren't the same as Paxlovid. Paxlovid is a medication was approved by Food and Drug Administration when it came out. It's based on it being fairly new, and it being at Amazon it may be a breakthrough in the medical history, because the large number of people that are dying from COVID hasn't slowed down. It slowed down to some extent, but it hasn't slowed down. It just resurfaced spring break. It resurfaced at Christmas. It resurfaced at New Year's. It resurfaced at Thanksgiving. All the festivities of rallies and spring break and summer approaching, COVID-19 is still approaching rapidly. With the migrants and flooding in the country, doesn't help matters any. The migrants at the border haven't been vaccinated or anything. They don't even have food at the border. They don't have water. They may have resources within reason of being at the border and people having bottles of water and people having bags of food, things like that going on. But they may not have they may not have the same food that you have going to the grocery store. I doubt it very seriously. So whatever the case is, I'm in the process of purchasing a Canon camera, 1DX Mark II Canon camera, and it's a flagship camera. It's not the usual camera. I'm recording on the iPhone 11 currently. The iPhone 11 is capable of recording continuously, but it doesn't have the foundation or the platform of an entire camera corporation as a flagship camera or a flagship phone. The iPhone 11 is a heavy hitter. It hits hard. It contains the level of information I generate, but it doesn't quite keep the audience that I disagree with tampering with my presentation out of the presentation. You got people that participate and try and sabotage my presentation to have one view, to have no views. At YouTube is some type of resistance I'm experiencing, and I can't tell if it's YouTube, and I can't tell if it's people participating. I really couldn't care less, because the accountability is what it is. When you have accountability of tampering with the information I generate, you causing people to die. If you causing people to die, then give them the right to defend themselves. Let them kill you before they die. That's only fair. Because if you jeopardize somebody that's in the hospital with full-blown COVID and by playing some prank, by bootlegging what I'm saying so you can make money off it while I starve, the extremes of my broadcast are too real to be tampered with, where the extremes are now. It's spring break now. When it's spring break now and summer's approaching, nobody has no time to play no games where they're going to die as a result of you trying to bootleg what I'm saying and making money. Paxlovid911 is not going to tolerate anybody sabotaging what I'm saying, getting the Paxlovid pill to Amazon. So the large group of people that's flooding the hospitals, flooding the country, that's participating in the rallies, that's participating in the festivities of spring break, the large audience of people, the large group of people that's coming in with COVID, they don't have no time for nobody to be trying to bootleg what I'm saying, where what I'm saying is getting the Paxlovid pill to Amazon and have people have access to Paxlovid911, so they have the understanding of what to do and how to do it to prevent from catching COVID or eliminating COVID altogether. Preventing COVID is more like staying out of large crowds, hands washing, not being in places where COVID-19 lurks. When you go to the store, don't give people space. Don't play nothing no less than what it appears based on COVID being present. You don't know who's in the store. You don't know who's been there. All you know is at the time of the year is, the more you're around people, the more you're exposed to COVID. That's all you know. When you touch things, you have to be strategical touching things. Wash your hands, wipe your hands. Try not to touch things and then touch your mouth. Try not to. It's impossible at times. COVID-19 is a germ, is a virus. COVID-19 is a virus. What happens is the virus is fighting to live. And when the virus is fighting to live, it's fighting to live wherever it can live, wherever it can live. So when you touch something and the virus is fighting to live long enough to get somewhere else to live, from touching something and putting your hands in your mouth is right near where COVID exists. If you go to the store and buy some cookies, the time factors of catching COVID and where you are at the store, if you're in a congested store and you buy some cookies and immediately start eating the cookies, the congestion of the store creates a likelihood of you catching COVID as opposed to it being a store that's usually not crowded. If it's a store that's usually not crowded and you start eating the cookies, the likelihood of you contracting COVID is not in the same place. If you've been vaccinated, 3 or 4 booster shots, the likelihood of you catching COVID is not in the same place. But if you've never been vaccinated for COVID, and you go in the same store and buy those same cookies that's not crowded usually, the likelihood of you contracting COVID is not in the same place as somebody that's been vaccinated, got 3 booster shots, keep their distance, wash their hands, and not be in large crowds usually, or around people from different countries. The likelihood is not in the same place. The likelihood is greater that you contract COVID. If you've been vaccinated, you're not okay. You may still contract COVID and get sick and have headaches and things like that. Just being vaccinated, because when they created the vaccines were created without being completely 100%. They were created for emergency use. There are no other cures, so that the emergency use applies to not having any other medications to treat COVID-19. COVID-19 is killing people. So the urgency is in the same place. Take Moderna and it treats COVID. But you don't know what the side effects are over long term and things like that are going on. That's what's going on right now. As you take Moderna, Pfizer, Johnson & Johnson, Novavax, they're for emergency use. They're not for the chickenpox, where chickenpox is established. It has a shot that's been established over time, and the side effects are limited. You don't have the same side effects for chickenpox, where chickenpox initially was an outbreak. Now that chickenpox has medications for chickenpox and other diseases, other illnesses, they're well established. Well, COVID-19 vaccines are established, but the long-term effects of the long-term side effects aren't understood completely. Now you have ocean differences where the fish are acting strangely and dying all of a sudden. Nobody knows what the difference is. Nobody knows if the fish can catch COVID or not. All we know is the vaccines have been approved for emergency use, and you have to take the Paxlovid pill or the vaccines, Moderna, Pfizer, Johnson & Johnson. They have other brands of vaccines before you die. You take those vaccines before you die. That's the emergency use aspects of the Food and Drug Administration approving the vaccines for emergency use. It's no etched in stone vaccine that you can use that has no side effects, that has no differences of taking it. You can just be allergic to the medication and die. It has no guarantees attached with Food and Drug Administration approving the vaccines. So when they approved Paxlovid pill for emergency use, I immediately said, get that pill to Amazon. Immediately. Because the influx of patients at the hospitals from season to season, from festivity from festivity, from holiday to holiday, from migrants being at the border, all year round, the demand is present. The demand gives you the option to say, well, you're going to separate the early detection patients that just contracted COVID, just got into the country, just went to spring break, just approaching summer, just went to the grocery store, just went to the party, just went to the rally. You separating that crowd. When you separating that crowd, now you can treat full-blown patients with Regeneron and other medications that you treat full-blown patients with that have pneumonia and full-blown symptoms or full-blown results of COVID directly. Now you have time to treat them. Now they don't die. They die with the influx of early detection patients. I'm coughing. I don't know what's going on. Doctor saying, calm down. We have to find out what's wrong with you. We don't know what's wrong with you. Have you been around a lot of people that, they ask you all these questions, but they don't know what's wrong with you. It's like a mechanic fixing a car, but when the car can't be fixed, you die. You're not a car, you're a person. You die if the doctor can't treat you immediately. So with all these people congested in the hospital, you might go to the hospital and the hospital might have no people in there based on appearing not to be crowded with patients with COVID-19. You may go there and be that, but where are they going? They have to be going somewhere. They can't be in the emergency room. They're going somewhere. They can't be in the hospital. You have all those people at the border, all those people at the party, all the people at the festivities, all the people at the rallies, all the people at spring break contracting COVID. Where are they going? They have to go somewhere. Click on the link. Donate. Support my efforts of getting the Paxlovid pill to Amazon. Peace. $1.50. Donate. Peace.